Let's talk about treatment acceptance tools. You know, one treatment acceptance tool that we use in our office that really helps is dictating in front of the patient. Yeah, I know it's a pain to dictate, and I know there are ways that we can do it, check boxes and well, not check boxes these days, but what we can do on computers in order to be able to generate a letter quickly, using some of the letter programs. That's not the point. The point is actually to use dictating as a teaching tool. Now, it took me a while to learn this, and it's a skill that you develop. But essentially, dictating in front of the patient becomes a teaching tool, and you can use that. You can use it very well. Now, the tool that we use is a smartphone. We used to use dictating equipment. You don't have to do that anymore. If you buy a Google Suite or Gmail Suite, you can get HIPAA compliant type of materials, which allows you to dictate and transmit it to a transcriptionist. You can use Dragon Naturally Speaking as well. We don't choose to use that because I'm lazy and my daughter works for me. My daughter actually lives 75 miles from me, so I can dictate in the phone and it goes to her. She types it out at her home and she prints it out on our printer. So it's pretty cool, pretty neat the way technology works. But there's no problem using voice recognition software. That's fine. It's the principle of dictating in front of the patient. So let's use this as an example. I'll show you how to use the smartphone a little bit later, and we'll look at this. So here's a patient, and you'll see that there's periodontitis. You've got evidence of loss of bone support, things like that, and you've got certainly evidence of caries here on a tooth that's endodontically been endodontically treated, is failing. Here's a better view of it, so you can get the idea that, of course, that tooth is going to be lost. You see the areas of caries here. You see the super eruption here. You see those kinds of things going on. We're going to use two things here. We're going to use the CT scan, which I love, and I think a CT scan is important for every patient that we see. I can't think, unless you're talking about a young person who doesn't have a lot of disease and doesn't have orthodontic problems, I think the CT scan is invaluable for orthodontics. We take one on every patient, and as some of you know, we charge $79 for the whole thing, which is, of course, a bargain. And for those patients who are referred, we do the whole thing for nothing, really, for a $50 donation to charity, where they write a check to charity, and we see the patient. That's on the referred patients. They have the opportunity, as a result of their referral, to be able to give the patient a little bit of an extra perk. We've talked about that before. We'll talk about that again. So let's look at how we would treat this patient. So I'm going to do the dictation right now and see how it comes out. This is a consult on so-and-so. Doctor is so-and-so. In fact, we're working with a referring doctor, which we still do from time to time. Patient presents with severe periodontitis. There's loss of bone support throughout the mouth. There's also areas of caries. As listed in the chart. Some of these teeth cannot be saved. But the only one I see that can't be saved right now is tooth number 30. It's also possible numbers 24 and 25 won't be able to be saved as well. As a matter of fact, the position of the teeth indicates that they can't be saved. Right now, I think the most important thing, though, is to get the periodontitis under control. So here's what we're going to do. We're going to run an oral DNA test. Patient will spit in a cup, and we'll be able to send that out to the lab and find out what bacteria is growing there. If there's aggressive bacteria, we'll then be able to prescribe the appropriate antibiotic to accompany the treatment that we're going to be doing. The treatment that we need to do with these deep pockets is perioscopy. We'll be placing a camera below the gum line and cleaning the root surfaces very thoroughly. We'll then do a full reevaluation and see how everything is doing. At that point, I don't want to extract any teeth. I just want to see how the patient responds to periodontal treatment before we farther. Time of reevaluation will look at the other areas. So here are the areas that we should be concerned about. Number one, did this tooth number 5, did that stabilize? By the way, we'll probably do a bite adjustment to take that so that tooth isn't biting on anything, so we get maximum ability to heal in that area. Number 2, how did the rest of the areas respond? In the time of reevaluation, we're going to have to make some restorative decisions. Here's what I think is going to happen. I think that there's a reasonable chance that this tooth can be saved, at least for a while. The other thing that I see is there's not enough function on the left side, and the patient also is complaining that she can't smile very well. She's holding her smile back because this tooth this molar is gone. Now, the molar is going to be a little bit difficult to replace. We've got to look at what we're going to do in that area. If we take a look at tooth number 13 also has lost a great deal of bone support. And we're going to have to decide whether we'll need to extract number 13 and replace number 13 where there's where there might be reasonable bone for a dental implant, along with implant number 14. But if we take a look at the number 14 area, in the number 14 area there is inadequate bone. So in order to place an implant in that site, we'll need to raise the sinus up a little bit in order to be able to create enough bone support for a dental implant. One tooth, the teeth that I know are going to be extracted are tooth number 18. That's going to be in the way of any tooth here because that tooth is super erupted. It would interfere with the bite in this area. We're going to extract the two lower front teeth because those two lower front teeth have lost their bone support, and frankly, they're in a bad position anyway. And finally, we're going to extract tooth number 30. At that point, we'll decide what the best way of replacing the teeth are. Should we use a fixed bridge? A fixed bridge attached to this tooth, this tooth, this tooth, and this tooth, meaning 22, 27, 29, and 31. Should we use that in order to be able to support a fixed bridge and eliminate implants entirely? That's a possibility. So when we do the reevaluation, we'll be talking about that, and we'll determine with the patient exactly what options we'll have. End of note. Okay, so we've done a dictation, and notice we've explained what's going on during the dictation. Now, will the patient get the whole thing? No, but my assistant will, and now the assistant has a full hour with the patient after I've done the dictation to be able to explain what's going on and explain the options. What we're looking for right now is acceptance of periodontal treatment only. She needs that. Then it's a matter of what do we need to do afterwards in order to be able to make things work. So perfect those skills. Look at those skills. Determine what you can do in order to be able to dictate in front of the patient. It's going to make a big difference, both to the patient as well as the assistant who's now learning more about dentistry as a result of your dictation. All right, so now let's look at the mechanics of this. So we go to the smartphone, and you'll see some graphics coming up. And we use an app called Smart Recorder. And so we click on Smart Recorder, and then we get into an area where it says Start Recording. So I'll push Start Recording, and now we'll start to record. So I'm recording, and I'm talking, and I'm doing the same dictation that we do. If we need to pause for some reason, you can push pause, and then you can push resume. And then we have finished the dictation. Now what we'll show is a screen that will say rename, and you can rename it if you want with the name of the patient. We don't, because it's going to go to my daughter, and my daughter knows the name of the patient anyway because I've put it in the dictation. So we will push OK, and then we'll push that little drop down arrow on the right side, push share, and then it will go to the folder that we've designated for this particular for dictation. You'll see it's dictation 9.4.18. We established this folder on that date. So we just click on the folder that's automatically uploaded to Google Drive, and now my daughter can see it. I think dictation is still important. I know that we've got other ways of doing this, and as I said, whether you use this way and use a transcriptionist or use Dragon Naturally Speaking, and you can then use voice recognition and make the corrections yourself. Either way is good. It's the teaching tool that's important. That's it. I'm Dr. Lee Shelton.